Alright, so for the next beta blocker drug that we'll be looking at the pharmacology of what? Pindolol. Pharmacology of Pindolol. Alright, so under this drug, we get to look at the mechanism of action of this drug, the pharmacokinetics, the indications and side effects of this drug. Okay, so I get to know this drug in depth. Alright, so we are saying that this Pindolol is a beta blocker. So it's used primarily to treat what? High blood pressure. That's hypertension. Okay. And it's also used to manage some certain heart conditions. Okay. So here's a brief overview of its pharmacology. So for mechanism of action, we say that Pindolol works by blocking beta 1 and beta 2 adrenergic receptors. So these beta 1 and beta 2 adrenergic receptors, when they are blocked, it's basically reduce how the heart is beating, how fast the heart is beating, and therefore it's now crash the blood pressure. Okay, so it is also a mild intrinsic sympathomimetic. It also has mild intrinsic sympathomimetic activities, meaning that it can partially stimulate beta receptors while blocking them. Okay, so this is a Pindolol. So for the pharmacokinetics, Pindolol is rapidly and well absorbed from the gastrointestinal tract with an oral bioavailability of 50 to 95%. Distribution, it has a volume of distribution of approximately 2 liters per kilogram of the person. Okay. Metabolism, Pindolol is metabolized in the liver. That's first pass effect, and it's primarily done via glucuronidation. Excretion, it is excreted mainly through urine. About 35 to 40% of it is excreted as unchanged drug, and it is excreted to a lesser extent in feces, about 6 to 9%. So onset of action, the effect of oral administration is okay. The effect of oral administration will begin within 1 hour. Duration of action, the effect lasts for about 3 to 4 hours, but this can be prolonged in elderly patients or those with liver cirrhosis. Okay, so half-life, the elimination half-life is approximately 3 to 4 hours. Elimination half-life is 3 to 4 hours. Okay, so moving to the other ones for indications now. That's basically the different types of disease conditions that you might want to use this Pindolol. It's indicated in the management of hypertension, that's high blood pressure. Also in the management of angina pectoris, that's chest pain. There's some certain types of arrhythmias. Arrhythmia is basically your heart is not beating as it should. Okay, so that's irregular heartbeats. It's also used as a prophylaxis of acute stress reactions. Okay, so what are the side effects of this drug? So the common side effects will include things like dizziness, fatigue, and it will make your heart beat slow. Okay, that's bradycardia. Serious side effects could include things like heart failure, bronchospasms, and liver problems. Okay, so that's it for the pharmacology of Pindolol.